Hi guys, today I'm going to share with you the most frequently asked questions about the novel coronavirus. I think I'm doing this video because many people out there are suffering because of this coronavirus, and they have a lot of questions. And right now the coronavirus is affecting 213 countries and territories around the world and two international conventions. So let's hop into the video. So starting off, what is coronavirus? The coronavirus is a family of viruses that can cause a range of illnesses in humans, including common cold and more severe forms like SARS and MERS, which are life-threatening. The virus is named after its shape, which takes the form of a crown, which protrusions around it, and hence is known as coronavirus. How has it affected the economy? Worries are mounting. The plunged quarantines, supply chain disruptions, and a sharp reduction in tourism and business travel could weaken the global economy or even cause a recession. And I think this is a very huge matter, and it's not a laughing stock. So everyone should treat this seriously. Yeah. How do we keep ourselves safe at home? Easy. I think this is a easy. Like, it's easy. It's easy to do, but many people who are stubborn don't do it. And these are my few suggestions, and I think this will help you out a lot. One suggestion is by following the simple 6-step hand wash. This skill is easy to learn, and it's very important for safety. The first step is rub palm to palm. Second, palm to palm, fingers infected. Right palm over left dorsum and left palm over right dorsum. Backs of fingers to opposing palms with fingers interlocked. And the fifth step is rational rubbing of right thumb clasped in left thumb and vice versa. The last but not least step is rational rubbing back and forwards with clasped fingers of right hand in left palm and vice versa. So, how does the virus spread? The virus that causes COVID-19 is thought to spread mainly from person to person, mainly through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another, within about 6 feet. COVID-19 seems to be spreading easily and sustainably in the community in many affected geographic areas. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they have been infected. Why are we seeing a rise in cases? The number of COVID-19 cases reported in the United States is rising to increase the laboratory testing and reporting across the country. The growing number of cases in part reflects the rapid spread of COVID-19, as many U.S. states and territories experience community spread. More detailed and accurate data will show us to better understand and track the size and scope of the outbreak and strengthen prevention and response efforts. Right now, there is close to 1.65 thousand cases, 1.65 million cases in USA only, and there are over 97,000 deaths in USA, and still people and thus people are really scared of this virus because it has hit one of the biggest and one of the most popular countries ever. Yeah. So can someone who has the virus spread it? I think we all know this, but I just added this just for people who are who has this question. The virus that causes COVID-19 is spreading from person to person. People are thought to be most contagious when they are the sickest. That is why CDC uh, recommends uh, that these patients be isolated either in the hospitals or at home, depending on how sick they are, until they are better and no longer pose a risk of infecting others. If you don't know what CDC means Centers for Disease Control and Prevention. Yeah, so back to the slides. More recently, the virus has also been detected in asymptomatic persons. How long someone is actively sick can vary, so the decision on when to release someone from isolation is made using a test-based or non-test-based strategy. Example: time since illness started and time since recovery. In consultation with state and local public health officials. The decision involves considering the specifics of each situation, including disease severity, illness signs and symptoms, and the results of laboratory testing for that patient. What are other ways to reduce the spread? First things, avoid touching your face in when you're outside, and always wash your hands. Second, only go out for essential needs, and it is mandatory that you wear a mask when you go out in most countries, and this is to stop the spread of the virus. And in places like Singapore and like most places, you will have to pay a huge fine if you don't wear a mask when you go out. So, and the last step is eat healthily, avoid eating fast food, and also um, one step I forgot to mention in this is only um, buy stuff that you eat and stuff that you only need, and do not overbuy. Do not panic buy, as this will cause others. This will influence others to also panic buy and may cause in food shortages. So one of questions arousing in this state is it okay for me to donate blood? In healthcare settings across the United States, donated blood is a life-saving essential part of caring for patients. Even my parents also donate blood always, and they I also think that donating blood is a good act, and it's very well needed to save other people's lives. The need for donated blood is constant, and blood centers are open and in urgent and need of donations. CDC encourages people who are well to continue to donate blood if they are able, even if they are practicing social distancing because of COVID-19. CDC is supporting blood centers by providing recommendations that will keep donors and staff safe. Examples of these recommendations include spacing donor chairs 6 feet apart, thoroughly adhering to environmental cleaning practices, and encouraging donors to make a donation appointments ahead of time. So Next question is: does CDC recommend the use of face mask or face shield to prevent COVID-19? In light of data about how COVID-19 spreads, along with evidence of widespread COVID-19 illnesses in communities across the country, CDC recommends that people wear a cloth face covering uh, to cover their nose and mouth in the community settings. This is an additional public health measure people should take to reduce the spread of COVID 19, in addition to social distancing, frequent hand cleaning, and other everyday preventive actions. A cloth covering a cloth face covering is not intended to protect the wearer, but may prevent the spread of virus from the wearer to the others. So it is to necessary to always wear a mask in public. A cloth face covering is not intended to protect the yeah. This would be especially important in the event that someone is infected but does not have symptoms. A cloth face covering should be worn whenever people must go into the public settings. Example: grocery stores. Medical masks and N95 respirators are reserved for healthcare workers and other responders, as recommended by current CDC guidance. And so it is not a good idea to buy a lot of masks at once just to save your family, and it's a very irresponsible act, as we are in this together and we will be out of this together. So, and the people who need this the most are the people who are suffering from who are helping the people, like the nurse who are helping the people who have COVID-19 recover, like nurses and other healthcare workers. By the way, sorry for stammering, as I am new to this. So, am I at risk for COVID-19 from mail, packages, or products? There is still a lot that is unknown about COVID-19 and how it spreads. Coronaviruses are thought to be spread most often by respiratory droplets. Although the virus can survive for a short period on some surfaces, it is unlikely to be spread from a domestic or international mail, products, or packaging. However, it may be possible that people can get COVID-19 by touching a surface or object that has the virus on it, but then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. It has been the end of the presentation, and these are the credits to images and information used. Stay home, stay safe, break the chain, be the difference. By the way, I'm so sorry for stammering. I'll say this again. I'm sorry for stammering, as I am really new to this. And peace out.